All right, so today we're diving into a future of healthcare that's, um, well, it's straight out of science fiction.
Yeah, it really is something.
Hospitals are ancient history,
Right.
and we're talking tiny robots zipping around in our bodies.
It's wild what they're coming up with.
Forget house calls, this is inside you call.
Exactly. And this source material, Post-Singularity, Unified Health Ecosystem, it really lays out a potential framework.
Unified health ecosystem that has a certain ring to it, but what does that even mean? Like in real life, are we saying goodbye to doctors altogether?
Well, not quite. It's not as simple as just swapping out doctors for algorithms, right?
Mm-hmm.
Think more along the lines of a healthcare system that's it's proactive, it's
Yeah.
predictive instead of reactive like what we have now.
Okay, so less about waiting for something to go wrong and more about keeping our bodies in tip-top shape all the time.
Exactly. Constant monitoring, micro interventions,
Hmm.
just keeping everything in check before anything even has a chance to go off the rails.
So like having a personal mechanic for your body on call 24/7.
Pretty much. And the key here is AI.
Right.
AI fueled by the singularity.
Okay, so for those of us who maybe haven't quite grasped this whole singularity thing yet, could you break that down a bit?
Sure. So the singularity, it's basically this hypothetical point in time when artificial intelligence becomes smarter than humans, leading to this explosion of technological advancement, which according to this document will especially impact healthcare.
And AGI, artificial general intelligence, that's like the engine driving this whole healthcare revolution. Huh?
Exactly. AGI is the powerhouse here. It's got these human-like cognitive abilities, but amped up to a superhuman level.
Okay.
It would be crunching massive amounts of data, like your medical history, your genetics, real-time data from wearables, and putting together this incredibly detailed picture of your health.
So no more filling out those endless forms at the doctor's office.
Right.
I can get behind that. But seriously, what would this AGI actually do with all that information?
Well, imagine an AI doctor that knows literally everything about your body down to each individual cell. It could tell you your risk of developing certain diseases, tailor treatments just for you, even simulate how your body would react to different therapies.
Whoa. Okay, now that's impressive. Personalized medicine on a whole other level.
It's closer than you might think.
Really?
This source material highlights how AGI could completely change how we discover new drugs, how we conduct medical research, even personalized diet and exercise plans.
This is already mind-blowing, and we're just getting started. Let's dive into some of the actual technologies that would make this post-singularity unified health ecosystem a reality, starting with nanobots.
This is where it gets really cool. We're talking about microscopic robots smaller than a blood cell patrolling your body, delivering treatments directly where they're needed, repairing damage at a molecular level.
Microscopic surgeons clearing out clogged arteries, zapping cancer cells before they even form.
Exactly.
Incredible.
Nanobots could completely change how we treat everything from cancer to chronic diseases, making healthcare more precise and less invasive.
Okay, that's pretty amazing. But nanobots aren't the only game in town when it comes to the future of healthcare. What about biosensors? Are they like the eyes and ears of this whole system?
Exactly. Forget those clunky fitness trackers. We're talking about biosensors woven into your clothes, maybe even implanted under your skin, constantly monitoring your vital signs and sending that data back to the AI.
It's just like a constant feedback loop,
Right.
letting the AI know how your body is responding in real time.
Exactly. And this constant stream of information allows for incredibly precise interventions and adjustments to your healthcare plan, making sure you stay healthy.
So we've got these nanobots doing microscopic surgery and biosensors feeding data back to our AI health gurus. It's all very impressive. But what about the human side of things? What happens to hospitals and doctors in this brave new world?
Well, that's a question the source material really digs into, and it suggests we might be moving away from these big centralized hospitals and towards a more distributed, kind of localized model of care.
So instead of having these massive medical complexes, we'd have smaller, more accessible clinics.
Yeah.
Maybe even mobile units decked out with all this advanced tech.
Exactly. Imagine specialized care, even robotic surgery coming directly to you, no matter where you are. No more long waits or traveling huge distances to get the treatment you need.
Hold on now. A robotic surgery unit pulling up to my house like an ice cream truck. This is some serious Jetson stuff.
It might sound like science fiction, but the technology is moving in that direction. And this shift towards decentralized healthcare could be a game changer when it comes to health equity.
I can definitely see that reaching underserved communities, providing equal access to these cutting-edge treatments, regardless of where you live or how much money you make, that's huge.
Exactly. This source material emphasizes that this isn't just about making healthcare more high-tech, it's about making it truly universal. It's about a future where everyone has a fair shot at living a longer, healthier life.
And speaking of longer lives, this document touches on something even more radical. The idea of using AI and regenerative medicine to actually extend human lifespans way beyond what we thought was possible.
Right. It's a concept that's both incredibly exciting and a little bit unnerving, using these technologies not just to treat diseases, but to potentially slow down or even reverse aging itself.
Wait, are we talking about living to be 150 or even 200 years old? What would that mean for society, for the planet, if people were living that long?
These are exactly the kinds of questions this source material wants us to consider. It's not just about the wow factor of the technology, but the profound impact it could have on everything. How we work family structures, our understanding of life and death. It's a lot to unpack.
It really is. I mean, on the one hand, who wouldn't want a few extra centuries to travel the world, learn new things, some more time with loved ones? It's tempting, to say the least.
Absolutely. But we also have to think about the potential downsides. What about resource allocation over population, the possibility of making existing inequalities even worse? If these life-extending treatments are super expensive and only available to the wealthy, it could create a whole new level of disparity.
That's a sobering thought. It seems this post-singularity future, while full of potential, isn't without its share of challenges and potential pitfalls. It's not all sunshine and nanobots, is it?
Definitely not. And that's why it's so crucial to be having these conversations now to really consider the ethical, social, and even philosophical implications of these technologies before they become a reality.
So while we're marveling at the possibilities of this high-tech healthcare future, we need to be thinking critically about the potential downsides as well.
Right. We can't just focus on what we can do, but also what we should do. What kind of future are we creating, and how do we make sure it benefits everyone, not just a select few?
Those are some big questions. And honestly, after diving into this source material, I'm not sure I have all the answers, but I definitely have a lot more to think about.
And that's what this is all about, isn't it? To get people curious, to challenge their assumptions, and to give them the knowledge they need to navigate this future that's coming at us fast.
This whole conversation has been a whirlwind. We've gone from microscopic surgeons to the possibility of radically extended lifespans. Where do we even go from here?
I think the next step is to talk about the potential risks and challenges associated with this post-singularity health ecosystem. It's great to be excited about the possibilities, but we need to be aware of the potential downsides, too.
Okay, let's do that. Let's pump the brakes on the amazing for a minute and talk about what could go wrong. What are the risks, the unintended consequences we should be aware of? So we're back and ready to explore the potential downsides of this high-tech healthcare future. What could go wrong?
One of the biggest concerns is data privacy. We're talking about a system that knows our bodies and minds inside and out.
That's a ton of sensitive data. What's to stop hackers from getting their hands on it? Or from the data being misused or even used against us?
The source material addresses this, actually. They suggest a multi-layered approach to security,
Yeah.
encryption, blockchain technology, maybe even AI systems designed specifically to detect and prevent breaches.
That sounds intense, like something out of a spy movie. But even with all that, what about the people who do have access to the data? How do we make sure they're using it responsibly?
That's where things get really complicated. This future of personalized AI-driven healthcare requires a lot of trust. Trust in the technology, trust in the systems, but also trust in the people handling all this sensitive data.
It's almost like we need a whole new set of rules, regulations, maybe even laws just for this new era of healthcare.
Absolutely. And the document emphasizes that this isn't something that can be decided by tech companies or even governments alone. It requires a conversation,
Okay.
an ongoing dialogue between policymakers, tech experts, healthcare providers, and most importantly, the public.
So it's not just about the technology itself, but how we use it ethically and responsibly.
Exactly. It's a societal challenge as much as a technical one.
This deep dive has been a real eye-opener. This future of healthcare, it's full of potential, but it's not without its risks.
It's a future that requires careful thought, open and honest discussions, and a real commitment to making sure these powerful technologies are used for good.
Well said. This journey into the post-singularity health ecosystem has been both inspiring and a little bit daunting. But it's definitely given us a lot to think about.
And that's what we aim for, to spark curiosity, to challenge assumptions, and to equip you with the knowledge you need to navigate this future that's rapidly approaching.
To our listeners, the future of healthcare is being written right now. Stay curious, stay informed, and most importantly, stay engaged in the conversation. because ultimately it's up to all of us to shape this future responsibly. Until next time, this has been your Deep Dive.